American Addiction Centers. This is Nick on a recorded line. How can I help?
There's a lot of stigma behind being an addict or struggling with substance abuse issues or mental health issues, and people are ashamed of it. I think one of the best things that I've seen here is that when you do talk to an admissions navigator, there's no judgment. And even if your situation feels very unique to your circumstances, we talk to thousands of people about this every single day. I think they can expect to be heard. They can expect not to be judged. They can expect to speak to someone who's very empathetic and can relate based off their own personal experiences as well.
One of the big things that I've noticed about working for American Addiction Centers with our team is that it's like a concierge service. You call in, you're struggling, you're upset about what's going on and how, no matter how devastating life may be, and we take it from there. We run your insurance verification, we do a quick intake over the phone, figuring out what's wrong, what's going on, and our guest goal is to get you to treatment as soon as possible. We want to make it as easy as possible on our patients.
Whether it's the addict or the family, they take the load off completely. I know parents are usually very grateful for what we do because they're spinning, they don't know what to do and they're trying to keep the person contained and safe and trying to figure out treatment, and it's too much. For the addict themselves, they're obviously not thinking clearly or they're just confused and scared, and I just think it takes the load off of whoever's calling.
There are a couple of things that are really, really important. Number one, you want to make sure that the place that you're calling is a dual diagnosis treatment program. The disease of addiction is driven by a mental health component, and if you don't address the problem at its core, the likelihood of relapse is going to be much higher. So a dual diagnosis treatment program that really focuses on not just the addiction itself, but the underlying issues that are causing or adding fuel to the fire, that is vital. Number two thing that I would say is you want to find a treatment program that's got multiple facilities. The reason I say that is because if you're looking at a program that's just got one facility, everybody has to go there regardless of background or age or substance use history or mental health concerns, and they're forced to have more of a cookie cutter approach. Whereas with us, we get you into the facility that best treats what your individual issues are. So we give a customized and tailored approach to your individual situation. Those two things are absolutely imperative when looking to really get recovery.
I think because they're going to be treated like a person. I feel like so many times, and I know I've experienced this too, when people struggle with addiction, they feel, again, very isolated, very alone, very scared, and we want to treat people as an individual. Your struggles are unique to you. The reason you drink may not be the reason I drink or use substances. The commonality is we both struggle. We both have loved ones that have struggled. And when you call into American Addiction Centers, you are treated like a person. You're not just a number on a file. You're not just another person that needs help. You have a face and a name, really, to what's going on. Whether we actually see your face or not, that's how we feel that we are connecting on this. And not only are the admissions process very personable, but also the way we help people and the way we treat people, I think, is very, very unique.
I think one of the most unique things about our call center is that you have people that are willing to really listen. A lot of the times, if you call other places, the first question that you're going to get asked is, do you have insurance? That's very common, right? Because they want to see if you meet the financial criteria. One thing that I take pride in with our team is that regardless if you're coming to American Addiction Centers or not, we're going to help you. And they take the time to really listen to your story, your situation, and then they help you really figure out what next steps are going to be in the best interest for you and your family. So I think that really is our biggest differentiator.